Oh, hi. I started doing some freehand drawing and I got a little immersed in it. My name is Dr. Cirecie West-Olatunji, and I am professor and director of the Center for Traumatic Stress Research at Xavier University of Louisiana. Today, we're continuing our series of 10 interventions with young children, particularly those who've experienced trauma. And today, I'm very excited. This is one of my favorite activities for children and adults alike, and it's freehand drawing. I already got started, and I decided I was going to draw a picture of my family, actually, and a picture that tells a little bit about what makes me happy, and it has to do with what we do when we're having fun. Now, the important thing about thinking about these drawings is that how you use them, how you interpret them, have a lot to do with your theoretical orientation. What you need, of course, is paper. Here I have construction paper, and it costs less than $1 from an art supply place. You can also get a artist's pack, and you can get a pad of paper and have that available in your office, very inexpensive. And then, of course, you need something to draw with. I have crayons here, but you could use markers. I think my favorite markers are the scented markers. Children really like that. When they take out the marker, take off the top, and they smell cherries or they smell grapes, they get really excited about that and they find their favorite. You can also use colored pencils. Now remember, you're thinking about children at various developmental stages. So for younger children, because they don't have the dexterity to work with the size of a crayon like this, you want to get the ones that are thicker, fatter for them to use. They're also available in that size for the colored pencils and for the markers and so on. So you do want to think about that. But it's really inexpensive. You could probably use paper that you have around, so you don't have to get the fancy paper. Go to the art store, go to Walmart or something like that. You can just use whatever paper is handy. And of course, crayons you could probably get for $1 at the dollar store. And so what you want to do is have these and have them available. And as I said, make sure they're developmentally appropriate. And then you direct the child to draw a picture of an image or a scene that is related to the presenting problem. So it does mean that you need to think about this ahead of time of what kind of direction you want to give to the child and how that's going to help you to either get them to open up and tell a story or to get them to relax. As they're drawing, you want to engage them in conversation. You want to encourage them to talk about what it is that they're drawing, and you want them to talk about how they feel and what is the meaning associated with that particular drawing. The purpose of this is, of course, as always, to create a very safe environment for children to recollect some of their experiences. Doesn't matter what they draw, doesn't matter whether they're very good at it. The idea is for them to just feel comfortable. This also helps us to develop rapport with our clients and to help them to get to know us, for us to get to know them. It is also a form of mindfulness. You can sort of get lost in drawing. And without any judgment, I think we all enjoy freehand drawing. It also provides an opportunity for the child to create a narrative in which they talk about their experiences, particularly about the objects or the scenes that are there. As always, it's non-directive, and so therefore it allows for child and culture-centered therapy. It promotes narrative storytelling, and it also can help us to assess intensity and severity of the trauma. What are the challenges? Well, I think I said none, but when I think about it, I think sometimes we feel a little inhibited to be able to draw, and so it's important for us to try to remove any inhibitions that we might have, as well as to encourage our clients to just be free. Just no one is judging them. If they're doing stick figures, that's fine. It's no problem at all. So it's important for us to make sure that we have a very non-judgmental environment in which we work. Skill level, just like the last one, a 1. So even a graduate student who hasn't completed their program or isn't licensed, that they could do this, I think, very easily. Of course, always working under a trained professional. A case that I could give you is a case of a 2-year-old white male who was brought to counseling by his mom after his parents were separated prior to a final divorce. It wasn't a really conflictual divorce, but of course, because they had irreconcilable differences, there was some conflict there, and the child was experiencing some of the loss and the grief associated with the dad leaving the home. The child presented with regressive behaviors such as bedwetting, a lot of tearfulness and agitation, and then began thumb sucking, and that was very disturbing to the mom. So what we did just to get started was to get a piece of paper, some crayons, and we just asked the child to start drawing. And eventually he opened up to be able to talk about it. In his picture, he drew his mom and his dad together and talked about how it felt for the parents not to be together again. So that was really great. So what do you need to do to get started with this? Of course, you need the paper. Construction paper works best because a lot of times thinner paper will break and tear as children are working on it. They're a little rough on a lot of the activities. You need drawing utensils of varying types. You need a lot of different colors to help children to reflect how they're feeling. And I think before you actually do this exercise with a child, you should draw a picture, your own picture of a time when you felt perhaps happiest. I use that as an emotion, but if you want to draw one where you were the most surprised, angry, sad, it's up to you, but to think about that. And then after you've drawn the picture, you might engage think about how you might engage with your client with this activity. I know you're interested in my drawing. I don't know if you can see it, but I drew me sitting down with my children, and we're watching television, and we often like to watch shows together because we're very loud, we're very engaged. We don't sit in quiet and watch a movie. We have a lot of opinions, and so it's a fun time for us. Please, I'm very interested in how you are using this particular intervention. Please email me, give me a phone call, go on our website. We have more resources there. Hit us up on Twitter or Instagram. We're at XULA_CTSR. And as always, I'm very appreciative for the assistance of the NYU Digital Studio and Faculty Resource Network staff. I look forward to seeing you in the next intervention. Thank you.